Hi, everyone. Welcome. It is amazing to see so many people here taking steps to improve your own health. And the numbers I see are still climbing, but it is 7 o'clock Eastern time. It's delightful to see everybody logging in and seeing where you are from in the country. Looks like we have people from both ends of the country. So wherever you are logging in from, welcome. Glad you could be here. And just a little bit of housekeeping. There'll be about 45 minutes worth of information. And then there'll be time for question and answer at the end of the presentation, maybe 45 minutes to 50 minutes, depending. And I'll do my best to get to all of your questions at the end of the presentation. If you have burning questions as we go along, feel free to type them into the Q&A area. That's easier for me to see the questions in the Q&A area than the chat area, because the chat area can get busy. I generally won't be able to see or check those as we're going along, because all I can see is my presentation. And if, like I said, if you have burning questions, then feel free to type them in, and I will do my best to get to all of those at the end. So without further ado, let us move on. Let's make sure this is working here. No, it's not. Okay, so welcome to the presentation. We will be discussing healthy hearts, myths and facts about cardiovascular disease, also called How is Your Endothelium Today? And wish I could do a show of hands of who knows, what that means, why it's important, what the heck is your endothelium, what does that have to do with heart health or anything else for that matter. We will get there. But this is such an important topic because we know that heart disease, heart attacks, and strokes is the leading killer of men and women in the Western world and in North America in particular. So this is an important topic that really does pertain to all of our health and mortality. And there has been a fair amount of misinformation, or that there's been information perhaps that maybe has led us astray, or hasn't been as useful or practical, as functional as it could be around this topic. So the goal for this presentation is to try to straighten that out and give you functional, practical news you can use. So first of all, let us start with a few definitions, or a big definition, to make sure we're all on the same page. The term cardiovascular disease is a huge umbrella term that technically encompasses any kind of condition or illness that affects either the heart and or the blood vessels. So yes, heart attacks and strokes, of course, fall in this category, but there's lots of other things that affect either the arteries or the veins. For example, a congenital or congestive heart disease is in there, and that's a common condition, but not one we're really going to be focusing much on tonight. So the point I'm trying to make is the terms cardiovascular disease or heart disease are general terms, and they're quite broad terms. But for the purpose of this presentation, for the most part, with a few exceptions along the way, I will say a few words about blood vessel health as well as heart failure. But for the most part, for this presentation, we're talking about primarily what's called coronary artery disease. This is also called atherosclerosis. You may have heard of this as hardening of the arteries. And this is particularly atherosclerosis of the coronary arteries. These are the main arteries that feed the heart, because this is what ultimately leads to heart attacks. So this is a big focus of this presentation because this is the big killer. However, it will also cover the health of the blood vessels in general, because everything we talk about that affects the health of the coronary arteries affects the health of all the other arteries in the body, as well as, to a lesser extent, the veins. But, I'll distinguish that as we go along. So just so we know where we're on the same pages, we're looking at heart health in terms of prevention of heart attacks is the main focus of this presentation. Okay, so let's get right to it and start out with some myths and facts. Let's start with I think probably the number one myth when it comes to heart disease, which is that cholesterol causes heart disease. This is probably the piece of information that has led us most astray in terms of our ability to take a really effective functional approach to heart health. The prevailing notion for a long time was that, or has been that, our arteries are like pipes that can become clogged with cholesterol, and when the cholesterol becomes clogged and the artery gets blocked, then you have a heart attack. But it's really so much more complex, so much, like, very much oversimplified. It's much more complex than that. And the fact is, this is important to know, 50% of all heart attack patients have normal cholesterol levels at the time of their heart attack and no history of ever having had high cholesterol. So this is important for a couple of reasons. First of all, you go get your cholesterol tested, it's normal, and you may think, super, since I have normal cholesterol, I am not at risk of having a heart attack. And that isn't the case. So that's the bad news. That you can have normal cholesterol and still have a heart attack. Half of people who have heart attacks have normal cholesterol. So don't think just because that your cholesterol is normal that you're in the clear when it comes to heart health. There are other risk factors that are more important to pay attention to. The other thing is that, for so long, there's been so much focus and emphasis on cholesterol. Is your cholesterol, high? Well, get it checked. If it's high, take a medication to lower it. And that would make sense if cholesterol causes heart disease. But if it doesn't cause heart disease, or if half of the people who have heart attacks don't have high cholesterol, then how is that helpful? Or is it helpful? So let's look at that. Next, myth or fact. And this is where in an in-person presentation, it makes it easier to be interactive. And I guess based on what I just said in the preceding slide, you can probably imagine whether this is a myth or a fact that cholesterol levels are a good predictor of having a heart attack. In other words, if your cholesterol levels are high, it is, a good predictor, you're highly likely of having a heart attack. Or if your cholesterol levels are low, you're at low risk of having a heart attack. And maybe I should have put this one first because it's a bit of a spoiler. I guess we've already seen the fact that 50% of people who have heart attacks don't have high cholesterol. So in fact, it's not a great predictor of whether or not you will have a heart attack. To drive that point home, I know there's a lot going on this slide. This is a snapshot, a screen grab from a British Medical Journal article that looks at the relationship between cholesterol, and by this I mean LDL, the low density lipoprotein, the so-called bad cholesterol, and mortality, so the risk of death in the elderly. And it shows that, in fact, that for people over the 60 years of age, cholesterol, even LDL, what we call the bad cholesterol, seems to have either no association with the risk of heart attack. In other words, higher or lower doesn't mean that you have more or less risk of cardiovascular disease. And there may even be what it says here, an inverse association, which that means that for some people, and it seems that a slightly elevated level of cholesterol is associated with a lower risk of early death, of heart attack, a death from heart attack, as well as, in a separate study, not in this study that I'm showing, as dementia. So a little bit of cholesterol may, in fact, be protective for people who are over the age of 60. And I bring this up because certainly in in-person presentations, there are many, many people who are very anxious about the fact they have been told their cholesterol is slightly elevated and should they take a statin medication. Now, I'm not here, I cannot overrule or speak against any recommendation that your doctor has made for any kind of medication. However, the threshold to the level at which statin medications, cholesterol lowering medications will be recommended or prescribed has lowered many times over the years. So more and more people are being told that their cholesterol is too high or meets the threshold for taking a medication. And the fact is, this study suggests that a slightly elevated cholesterol has no association with an increased risk of heart attack, death from heart disease, and may have a slightly, well, I won't go all the way and say protective effect, but may have a slightly inverse effect. So you may have a slightly lower risk. So maybe cholesterol is doing something good for us. So the fact is that Cholesterol is one factor in the risk of heart disease, but it's really not the only one. Absolutely. Focusing exclusively on cholesterol can definitely lead us astray in a more functional approach to heart health. And it's arguably not even the most important risk factor, because as we've seen, there isn't a great, especially for people over 60, a great association between cholesterol levels and risk of having a heart attack. For younger males, I would say between 40 and 60, very elevated cholesterol levels is something to pay attention to, especially in the context of other risk factors that we'll talk about. And by the way, we have also said over the years, cholesterol levels increase due to eating fat, right? For a long time, we thought saturated fat is where it's at when it comes to increasing cholesterol levels. And it turns out that cholesterol levels often increase in response to inflammation in the body, as well as high blood sugar and high insulin levels. So the idea of eating a low-fat diet to lower cholesterols, we know that the studies have shown that just really doesn't work, because typically when people eat a low-fat diet, they're eating more sugar, and that will elevate cholesterol much faster and more efficiently than a high-fat diet. And the most important thing to remember about cholesterol, we call this, we talk about good cholesterol and bad cholesterol, but ultimately cholesterol, even the LDL, the so-called bad cholesterol, it is only harmful when it's oxidized or damaged. And that's something that's usually not tested for. It can be tested for, but it's not usually tested for. And so what we call LDL cholesterol, the so-called bad cholesterol, that's essentially like a vehicle. You can think of it as a car that cholesterol travels in when it's coming from the liver to the rest of the body. It's the outbound flight, you could say. HDL, what we call the good cholesterol, that's the vehicle that cholesterol travels in when it's coming from the tissues back to the liver. So you can think of Bob drives two different types of cars. He drives one car to get to work, and somehow he drives another car to get home from work. I know that doesn't quite make sense, but the point is that when LDL, the car Bob takes to get to work, becomes oxidized, so it's rusted and it's fuming exhaust, then it's a problem. But if it's, as long as it's well tuned, it's not so bad. So I'll talk about a little bit more about that later on. But the point is, just because LDL is high isn't necessarily a bad thing. So if cholesterol isn't a great predictor of our risk of having a heart attack, then what is? If there isn't a good association, and certainly for people over the age of 60, there is not a strong association, no association, possibly an inverse association. What is a good predictor? Well, it turns out that the amount of calcium that you have in your coronary arteries, again, the coronary arteries are the three main arteries that feed the heart muscle itself. And it's when one of those gets blocked that there can be a heart attack. And we talk about hardening of the arteries or atherosclerosis. The hardening comes from calcium. And so, in fact, calcification in the coronary arteries turns out to be an excellent predictor of your risk of having a heart attack. Now, this isn't something that we normally get tested or can get tested, especially in Canada. In the States, they do this test as a matter of course for just about everybody. You can get a specialized type of CT scan that can image a beating heart, but in a still frame. So it's like a super fast CT scan. It's available in Canada through some private companies like Medcam, for example, in Toronto. But in the States, they have this, it seems like every corner store, or certainly every cardiovascular imaging center, everybody gets sent for these scans. And the amount of calcium built up in the coronary arteries is an excellent predictor of your risk of having a heart attack within 5 years of having the scan. After 5 years, the amount of calcium can change, but within 5 years, it's a great way of showing how much calcium is in there, and sometimes if it's in a particularly bad spot, but for the most part, it's the sheer volume. They just give you a number that represents the actual amount or like weight of calcium in the arteries. And this is absolutely very closely correlated with the risk of having a heart attack. So you can look into, if you happen to live near a US border and you're interested in getting this test, you can check that out. Like for people who are in the Toronto area, they do a test like this at Buffalo MRI. You can get, you can print off the requisition. I think they call it the heart scan, for example. You print off the requisition, drive down to Buffalo, get your scan. It doesn't take that long. And then you can get the results. So you can check that out for anybody who lives near the US border or vacations in the States, for example. Okay, so here, let's move on to some more myths and facts. We sort of, this spoiled my myth and fact. That was supposed to come up separately, darn. But here's the myth or the fact. Cholesterol-lowering medications are the best way to prevent heart attacks. Well, based on everything we've already said so far, you can probably guess that the fact is that statin medications do not have any significant value in saving lives for people who have never had a heart attack before. In other words, what's called a primary prevention, or helping to prevent first heart attacks in most people. And based on what I've explained about cholesterol not being a great predictor of heart attack or not being closely associated with heart attack, it now becomes a little bit clearer the fact that then going and lowering cholesterol, yes, cholesterol lowering medications will lower cholesterol, but they don't seem to have much impact on whether or not you're going to have a heart attack. And they don't seem to have any impact on whether people survive a heart attack. And so then you might wonder, well, why are we taking these? If you're wondering, where this information comes from, you can check out a website called the NNT. This is called the Numbers Needed to Treat. This is a website that basically reviews and evaluates all medications to look at their essential risks and benefits. And when it comes to statin medications, for people at low risk of cardiovascular disease, that means you're a otherwise healthy person with not extensive, you don't have a big family history of cardiovascular disease, you have normal blood pressure, you don't smoke. In other words, you're generally considered to be at low risk of cardiovascular disease. A statin medication doesn't seem to have any mortality benefit. In other words, you are not less likely to die from a heart attack or have cardiovascular death compared to somebody not taking that with the same risk factors. 1 in 217 people taking statins would avoid a non-fatal heart attack. 1 in 313 would avoid a non-fatal stroke, but 1 in 21 people experience pain from muscle damage due to the statin, and 1 in 204 develop diabetes due to the statin. So really, it would seem that the risks outweigh the benefits, and the benefits aren't fantastic for, again, people at low risk of cardiovascular disease who have never had a heart attack before. Statin medications don't seem to have a ton of benefits. So this is something to keep in mind or check out in terms of evaluating the benefits of certain treatments or therapies when you're looking at taking medications. Okay, so what other things can we pay attention to when it comes to cardiovascular disease? So what is important for our heart health? If we're going to put aside cholesterol for now, and it's not that we can throw it out completely, but again, for people without any other cardiovascular risk factors, then cholesterol on its own doesn't appear to be particularly important. So what are the other things to pay attention to? Well, weight. Being overweight is definitely increases the risk for heart disease. High inflammation in the body. Now, you've got inflammation if you are suffering with pain and chronic pain. You may still have inflammation and not be in pain. There are certain markers that can be checked, C-reactive protein, for example, on certain types of blood tests, but having inflammation in the body. Being a smoker is a big one, an obvious one. Having a sedentary lifestyle, so not exercising at all, being a couch potato, is certainly a risk factor for heart disease. Absolutely having diabetes or high blood sugar is an important risk factor for heart disease. And an extensive family history. If everybody in your family on one side or the other side or both sides had early heart attacks or early strokes, then you do need to reconsider, well, definitely everything else, you want to be doing everything else you can to lower your risk factor. That doesn't mean that it's a life sentence, for example, but just you need to pay more attention and reconsider the other risk factors. And high blood pressure. So this is the most important thing to pay attention to. Everybody should have their blood pressure checked at their family doctor as part of regular screening. If you have been told you have high blood pressure, you need to take your blood pressure medication as described and have your blood pressure checked regularly. Do not ever ignore high blood pressure. It is the single most important risk factor, certainly for stroke, but definitely for heart health. It is not something to be disregarded, ignored. Absolutely. I just can't say enough about the fact that high blood pressure is really important to pay attention to and take your medication as recommended and have your blood pressure monitored. So as you can tell, I'm not a huge fan of statins. I'm a big fan of blood pressure medications. All right, so let's back up a bit. So if we're talking about, well, let's see, we're going to back up to the heart disease risk factors. So there was this whole notion about, blood vessels being like pipes that can get clogged. But if that's not the case, why isn't that the case? And why is this notion of our clogged vessels really accurate? What is going on? And how can we take a more functional approach to our heart health? And by that, I mean heart and blood vessel health. Because we talk about heart health, but really we're talking about the blood vessels that feed the heart. And they are prone to hardening, just like blood vessels elsewhere in the body. And the fact is, blood vessels are not simply tubes or pipes that can get clogged. And that's because blood vessels have this dynamic lining. Yes, they're muscular. Yes, they can expand and contract. But they've got this dynamic lining in them called the endothelium that protects and regulates the health of the blood vessel. So think about this lining. It's just one cell layer thick. And this is called the endothelium, and it lines all of the blood vessels in the body. And each of the cells in the endothelium is responsible to, in conjunction with their neighbor cells, protecting, healing, monitoring the health of, and keeping healthy the blood vessel that surrounds it. It is an amazing dynamic process that absolutely can't be compared to a pipe that gets clogged. However, when cardiovascular disease occurs, if there is hardening of the arteries, if there is a damaged area that leads to the buildup of a plaque, for example, that ultimately leads to a blockage or a piece that dislodges and turns into a blood clot, heart attack, or stroke, you can think of this as a failure of or a dysfunction in the endothelium. You can think, what happened to the endothelium in the blood vessels and in this particular area, but usually it's happening all over, that made it fail, that stopped it from doing its job in protecting my blood vessel? Why did the lining fail? And if you look at it from this way, and then you look at the research behind this, you come to a much more functional approach to understanding and being proactive about cardiovascular health, because you'll realize that there's lots more things that affect the endothelium than cholesterol. And this is ultimately why cholesterol doesn't have as big an effect on heart health as we have been led to believe, because it doesn't always have as direct an effect, either harmful or helpful, on the lining of the blood vessels. So this is the secret life of blood vessels, and understanding our endothelium is really, really important to understanding heart health and many other aspects of health. Here's just another interesting screen grab from the International Journal of Biological Sciences. And I just really liked the wording of the authors here, because they talk about the endothelium and they talk about how the alterations in the endothelium. So when things go wrong in the endothelium, it is the underlying cause of what they call the most dreadful of human diseases, since the endothelial cells have a key function in participating in the health and maintenance of the blood vessels. And if things go wrong with the endothelium, then you're going to have all kinds of different problems, including stroke, heart disease, diabetes, kidney failure, tumor growth. It goes on and on. So they basically chalk up so many of the health problems that we have to, problems with the endothelial lining. So really, if you think of your endothelium collectively, all that one cell layer thick lining that lines all of your blood vessels, if you think of that as an organ, and if we think of, instead of February being Heart Health Month, it's Endothelium Health Month. It's not as catchy. It doesn't roll off the tongue. It sounds confusing, but this is really where it's at when we're talking about cardiovascular health. And ultimately, problems with the endothelium can and do lead to the problems that we associate with the heart and blood vessels, things like stroke, dementia, heart attack, all kinds of other, renal failure, for example. These are all related to endothelium function. Okay, so knowing this allows us to take a very proactive approach. Now, this is a particularly helpful proactive approach for people who have not already had a heart attack, in which case you should be under the care of a cardiovascular specialist who understands your specific concerns, blockages, for example, where they are, what's happening, monitoring that. But for people who are simply concerned about heart health for any reason, maybe there's a family history of heart disease, or you just want to be proactive about heart health, being mindful of your endothelium is a really functional way to approach this. So let's start with the bad stuff. Let's start with how to damage our endothelium. And you can get hints about how to damage your endothelium by the things that increase your risk. So we saw that list earlier with the couch potatoes of things that increase your risk of heart disease. Well, that's because all of those things are damaging to your endothelium. Being sedentary, believe it or not, just sitting around, not doing exercise, you think, how can that be damaging my endothelium? Well, people are made to move at least a little bit. And if we don't move enough, then it actually creates inflammation in the body. It's counterintuitive that you can create inflammation by doing nothing, but that's exactly what happens. If you don't have a minimal amount of exercise and movement regularly, then your body will start to produce inflammatory compounds that damage your blood vessel lining. So this is why being sedentary increases your risk of heart disease, because it's damaging your endothelium, your blood vessel lining. Smoking as well. This is a no-brainer. When you smoke, you take in tons and tons of free radicals, chemicals that, it's not the nicotine that's the problem. Other than being addictive, nicotine is not that harmful for your health. It's everything else in the cigarette. All those free radicals are very damaging to your endothelium. Stress is another thing, because ultimately stress will create compounds like free radicals and inflammatory compounds that will damage your endothelium. High sugar intake will do this. A lack of quality sleep will do this. Certain dietary components, particularly omega-6 essential fatty acids. So seed oils, things like canola, sunflower, safflower, these vegetable type oils, especially when they're cooked at high temperatures. It's the omega-6 fatty acids that are overrepresented in our diet that promote inflammation, as well as trans fats, things like margarine, for example, absolutely. And then a lack of key nutrients. So what I mean by this is that the endothelial cells, that lining, they need, like any other organ in the body, every organ in the body needs certain nutrients to do its job properly. And some nutrients are more important for some organs than others. For example, our brain is 60% fat by weight. So what you eat, or you are what you really are, what you eat, or your brain is what you eat when it comes to fat. The brain needs lots of healthy fat. Same thing with the endothelium. It needs certain nutrients to do its job, to know exactly when to help efficiently, relax, contract, heal damaged areas, regulate calcium. As we mentioned before, the big predictor of your risk of heart attack is calcification in those arteries. And so the endothelium needs a way to keep calcium out from depositing in the arteries. It has a way to do this, but it needs certain nutrients to do this. And I'll tell you what they are. So not having these nutrients, if these nutrients are underrepresented or missing from your diet, the endothelium simply can't do its job in keeping your arteries flexible, clear, and healthy. So we'll talk about what those are. Okay, so how to take care of your endothelium. What does your endothelium like and keep it healthy? Well, exercise obviously is the opposite of being sedentary. Just doing something, some kind of movement. You can overdo it with exercise. It is absolutely possible to over-exercise. That is not the concern or risk for most of us. So it's not necessarily more is always better, but we need to be doing something. Ideally, it's something that you enjoy and regularly. Relaxation and laughter are both excellent for your endothelium, literally shown in studies, and I'll talk about one later. Antioxidants. So I mentioned before, the reason why smoking is so hard on your endothelium and it leads to increased risk of heart disease is because of all the free radicals. We counteract free radicals with free radical fighters, which are called antioxidants. So more antioxidants, the better. Also lower sugar intake, that will be problematic. High sugar is bad for your endothelium. Low sugar is good. More omega-3 essential fatty acids. So omega-6s promote inflammation. Omega-3s are anti-inflammatory. I'll say a little bit more about that later. And then here I have what's called a Mediterranean type or Mediterranean style diet. So this is a diet that emphasizes lots of fruits and vegetables, herbs and spices, because colorful fruits and vegetables, herbs and spices, that color means antioxidants, herbs and spices, you'll have antioxidants, healthy fats like olive oil, for example, in this diet, as well as moderate amounts of you need to get your protein in there, absolutely. But, meat, fish, whole grains, this type of diet, as well as nuts and seeds. So this is a varied diet with lots of antioxidants and healthy fats. And this has been associated with better heart health and does all kinds of good things for your endothelium. Okay, so now we have this new understanding or a bit of a new paradigm or a way of looking at heart health that for the most part, for most people for who have low risk of cardiovascular disease, we are not primarily focused on cholesterol or exclusively focused on cholesterol, only keeping that as one factor in the bigger picture. So what are our new goals? Our new goals are to lower inflammation because inflammation is really problematic for the endothelium and it really prevents it from being able to do its job properly. Next one is to prevent cholesterol oxidation. Like I said, I was going to talk more about that. We talk about good and bad cholesterol, HDL and LDL. HDL is definitely good. You want your HDL up. Hey, if your HDL is over 2, you're doing very well. And that LDL, again, just because it's there doesn't mean it's problematic, but we want to make sure it doesn't become problematic. And that means it doesn't get oxidized. You can have lots of LDL. As long as it's not oxidized, it's not a problem. So we'll talk about how do we prevent that from becoming oxidized. Again, oxidation means free radicals, means antioxidants. That's a hint there. Maintaining healthy blood sugar. How much sugar we take in is far more important than how much fat we take in. The years and years of recommending low-fat diets for heart health did really nothing for the population other than encouraging us to gain more weight, did not do anything to reduce the risk of heart attack. Now, the good news, by the way, the rate of death from heart attack has absolutely declined in the last 3 decades dramatically, which is great. But that's because the life-saving procedures for heart attacks have gotten much better, which is fantastic news. Bad news is that the rate of heart attacks has still gone up. So wonderful that we're saving more people from heart attacks. We want to prevent the heart attacks to begin with. So maintaining healthy blood sugar, much more important than a low-fat diet. Maintaining healthy blood pressure. I can't say enough about this. Hopefully I emphasize that a lot in the risk factors. Get it checked, take your medication as prescribed, stay on top of your blood pressure. And finally, last but definitely not least, keeping calcium in its place. As I mentioned, it's the coronary arteries being calcified isn't really a good predictor of whether or not you're going to have a heart attack, because it's that hardening of the arteries that's a big problem. And then we're going to support the endothelium, keep the endothelium healthy. Okay, so what are the nutrients that heal the endothelium? There are a number of them. First of all, any antioxidant. Pick your favorite antioxidant. It will be helpful for your endothelium. But there are certain nutrients in particular that I'm going to focus in on because they are important to understand, and they are especially helpful for healing the endothelium, have beneficial effects for heart health. So we're going to talk about particularly vitamin K2, magnesium, and quercetin. But I will also briefly, before I do that, just touch on coenzyme Q10. And the reason why I mentioned CoQ10, this is a really fantastic antioxidant that is important for, yes, cardiovascular health, absolutely helps with the health of the endothelial lining. It helps with the action of the heart muscle itself. The heart muscle, as a muscle, it's always pumping and beating. That means it needs lots of energy, and CoQ10 helps the heart muscle cells make energy. So powerful antioxidant, powerful for heart muscle function, and statins will deplete coenzyme Q10. So anybody who is taking a statin cholesterol lowering medication, and some people may find that they need to, or they've been recommended, and because of their history and picture and family history, what have you, that they want to stay on their statin, that is fine. That you have to know that it depletes CoQ10. And so your pharmacist will be able to tell you more about that, than anybody who's taking a statin should be taking coenzyme Q10 with it. Okay, so then moving on to vitamin K2. Now, this is a nutrient that not as many people know about, but that is the subject of my book here in the right-hand corner, Vitamin K2 and the Calcium Paradox, How a Little Known Vitamin Could Save Your Life. And the calcium paradox is this paradoxical situation in which we absolutely need calcium to live, but we need it to be in the right places in the body. And when it lands in the wrong places, like our arteries, then it is a problem and it is dangerous and potentially deadly. What can we do? Well, vitamin D, for example, we know helps us absorb calcium, which is great, except vitamin D has no control over where the calcium goes. It could land anywhere. But there is a nutrient that helps to direct calcium to where it should be in the body, and that is vitamin K2. Vitamin K2 will channel calcium towards bones and teeth where we want it to be, and it will keep it out of and even reverse hardening of the arteries. So one clinical study with postmenopausal women has shown that vitamin K2 can reverse arterial stiffness, which is early stages of arterial, it's a form of arterial calcification, early stages of atherosclerosis. The arteries become stiffened with calcium. K2 has been shown to restore arterial flexibility, which is really important. And it does this by acting on the endothelial cells. When the endothelial cells have vitamin K2 at their disposal, they can rid themselves of inappropriate calcium or calcium deposits. And so that's really important. So we get vitamin K2 in our diet from grass-fed animal foods, so cows, chickens, pigs. This is in things like, butter, egg yolks, because it's a fat-soluble vitamin. When those animals have been out on the grass, eating like green foods, which is impossible in the winter in Canada, and not that common in the summer either. Certain types of fermented foods will provide, because the bacteria makes vitamin K2, will provide vitamin K2 year-round. So certain types of cheeses, Brie, Gouda, Jarlsberg are some of the cheeses, provide consistent sources of vitamin K2 that people can eat year-round. There's also natto. It's a Japanese fermented soybean food, and that is a big source of vitamin K2. So basically, the take-home points for vitamin K2 are arterial calcifications are an important risk factor and predictor of heart attack risk. And even when cholesterol levels are normal, calcium plaque can be lurking in the arteries. So this is where we see people who have normal cholesterol, but they're still having a heart attack. That's because their cholesterol was fine, but they still had calcium in their arteries. So vitamin K2 has been shown to reduce arterial calcifications and restore arterial flexibility. Now, here's the natto on the left. This is the highest known food in vitamin K2. It's a traditional Japanese fermented soybean food that's eaten as a breakfast food in some areas of Japan. It is highest known food in vitamin K2. You can get this in if you have Asian grocery stores near you. It comes in these like little white styrofoam containers in the freezer section. And you just thaw it and put it on rice and eat it. As you can see, the texture is sort of sticky, and it's a unique taste and texture. Some people love it right away. I wouldn't want to discourage you from trying it. I recommend everybody try it just for the experience. And some people love it right off the bat, and other people don't love it, but they eat it anyway. And so this is a great source of vitamin K2. There's also vitamin K2 supplements. So taking these will help to guide calcium into the bones and teeth and away from arteries. Also helps to, by the way, promote bone density. And for typical, you can get this in either 100 or 120 micrograms, same difference. It's very close dosage. With or without vitamin D, if you already have vitamin D and you're taking it, you can take vitamin K2 in a separate supplement, or you can take them together for convenience. And for most individuals, the 100 micrograms once per day, it would be a standard dose. There isn't a recommended daily intake established for vitamin K2 at this point, but that one capsule a day for general health maintenance would be considered to be a typical dose. For people who have bone health concerns, the clinical trials use about twice that. For people who have known arterial calcifications, so they've had the scan done, clinical trials for that have used about double again, 400 micrograms per day, which would be the same of eating one serving of natto every day. You'd be getting about 400 micrograms of vitamin K2. Vitamin K2, by the way, can't be taken with the blood thinner warfarin, but other than that, it does not have any drug interactions. Other blood thinners, the non-warfarin type blood thinners, things like Pradaxa, Effient, Xarelto, Eliquis, the other ones, aspirin, that is not a concern, but it's just warfarin, can't be taken with K2. Okay, next, moving right along. Next nutrient that the endothelium uses to maintain healthy blood vessels and also to keep calcium out of the blood vessels, in addition to vitamin K2, magnesium, the stress relief mineral, does so much for us. And it's because it acts on the endothelium that it helps the endothelium regulate the pressure inside the vessel. So supports healthy blood pressure. It's definitely an anti-stress mineral. It's actually quite a nice thing to take. I find it's nice to take at bedtime to help promote relaxed muscles, helps with muscle cramps and twitches, things like that. It works with vitamin K2 to keep calcium in its place. They both have a role there. Absolutely, magnesium supports endothelium functioning. The recommended daily intake, this is like the Health Canada recommended daily intake of magnesium, is between 360 and 400 milligrams of magnesium per day. It is so challenging. If you were to look at your daily diet, if you're getting even a fraction of that, even a quarter of that from your diet, that would be fantastic. It's very, very difficult to reach the recommended daily intake because we use magnesium for so much. When we're under stress, we need even more of it. So, magnesium-rich foods, do I have it here? Oh, no. Include green leafy vegetables, nuts and seeds. Those are the highest foods in magnesium. And it's worthwhile, making an effort to get those in on a daily basis. If not, a supplement can really make a difference in actually getting in the recommended daily intake of magnesium. Here's another screen grab of a study showing that low magnesium promotes endothelial cell dysfunction. So ultimately, we need a certain amount of magnesium in our bodies so our endothelial cells can do their job. And if not, then they can't work well. They will have dysfunction. And this has implications for hardening of the arteries, inflammation, blood clots, and basically blood vessel health. So magnesium helps to promote healthy endothelium lining. In terms of magnesium supplements, There are many of them on the market. My recommendation is pick your favorite one and make sure you're getting that recommended daily intake. So, most of us, it'll be that 400 milligram mark on a daily basis to make sure you're getting your magnesium. And like I said, really nice thing to take at night before bed. There's two main types you'll find on the market: magnesium citrate. I like to call this cheap and cheerful. It's the most affordable form of magnesium. Works very well, very consistently. Helps with healthy muscles, heart function, everything you want from magnesium you can get from magnesium citrate. And for some people, they find that it can be hard on their digestion and promote loose stools. If that is the case, then I recommend magnesium bisglycinate. I'm a fan. This is personally, over the years, what I have gradually switched to is the magnesium bisglycinate. And this is a form of magnesium that is highly absorbable, bioavailable, and gentle on the stomach. By the way, kids, big friends here, chewable magnesium citrate. Kids need magnesium too, and quite a bit of it. It's amazing what a difference it can make in their sleep and behavior and just overall well-being. For example, just off the top of my head, recommended daily intake of magnesium for kids between the ages of 9 and 13 years old is 140 milligrams per day, I'm pretty sure, if I remember correctly. So again, that's a lot and really tough for kids to get in enough through their diet. So lots of options: chewable tablets, capsules, powders that you can mix in to water or your smoothie or whatever. Lots of options for getting in magnesium. Okay, so let's move along to the one more thing I wanted to mention was omega-3 essential fatty acids, just shortly before we wrap up. Omega-3s, as I mentioned, these are anti-inflammatory. They counteract inflammation. They counteract the omega-6s in our diet. Super important for all kinds of aspects of our health, but specifically with heart health, they've been shown to lower triglycerides, reduce blood viscosity, which means make your blood less likely to form an unhealthy blood clot, help lower inflammation. And again, omega-3s will improve endothelial function. Taking a quality omega-3 supplement can reduce the risk of death due to cardiovascular disease by up to 62%, according to one study. Purity and potency are really important when it comes to omega-3s. In other words, you're making sure that the omega-3 does not have environmental contaminants that you would find in fish. That needs to be purified. And that the fish oil was not damaged during that purification process. It was not oxidized. And that you were getting enough of the omega-3s that you want in your fish oil. So there's lots of different options on the market. And this is where I find there's a huge range in quality. My goodness, I saw fish oil at my local dollar store not too long ago, and you can imagine that it wasn't that great a quality. So there's a new fish oil that has recently entered the market that is the highest potency that I know of in a soft gel formula for people who like soft gels. That is 1,100 milligrams, so a little bit over a gram of the omega-3s per one single soft gel. So 2,200 milligrams, or a little bit over 2 grams of omega-3s per 2 soft gels per day. There is a technology in these soft gels that prevents the fishy burp backs that we tend to get with fish oil, which is really common with fish oil. And they provide a high potency of what's called EPA and DHA, as well as DPA. So these are the actual omega-3s that are good for the endothelium lining and give us these heart health benefits that we're looking for. Okay, and then one more thing to mention in terms of nutrients that you may not be aware of that particularly important for blood vessel health, which is quercetin. Quercetin is a vitamin-like molecule that you find in foods like herbs and spices, green leafy vegetables, onions, grapes, apples, cherries. The highest known food in quercetin is capers. See these little everyone knows these, right? These are little like garnishes, or these little green buds that you get sometimes with seafood dishes in particular. These are the highest known food in quercetin. If you were eating a quarter cup of those every day, you'd actually be getting quite a good amount of quercetin in your diet. And look at all the foods on this picture. Now you maybe get a good understanding of why people are always talking about the Mediterranean diet. In fact, high quercetin content may be one of the key beneficial aspects of the Mediterranean diet. This quercetin in particular has been shown to be really, really important for endothelial function. So up here says where it says flavonoids, that's talking about quercetin. This little arrow down here pointing to improvement in endothelial function. Yes, these are antioxidants. Yes, they have anti-inflammatory effects. Yes, they're helpful for blood vessels or blood pressure, but it's really the improvement in endothelial function is where Health Canada has allowed quercetin to have it's the name or rather the claim on the quercetin products you'll see in Canada is blood vessel protectant. So this really is something that, because of the action, again, on the endothelial lining, protects our blood vessels and also happens to be a really fantastic free radical fighter. And so I mentioned before that the important thing about cholesterol is it not being oxidized. And when we hear oxidation, free radicals are to the rescue. They're causing the problem. Antioxidants are coming to the rescue. So quercetin is sometimes used for immune support and allergy relief, but it really shines as a blood vessel protectant and a free radical fighter. This form, quercetin lipomicelle, has up to 10 times higher absorption than a standard quercetin. When it comes to absorption, quercetin is an ingredient that you will absorb from a standard form, but it does benefit from absorption enhancement. So you get more from that. Okay, and then the very last thought I'd like to leave you with is a study out of the University of Maryland Medical Center that shows that laughter appears to cause the tissues that form the inner lining of the blood vessels, the endothelium, to dilate or expand in order to increase blood flow. Basically, laughter is a way to exercise and relax your endothelium. Your endothelium really likes laughter and responds to it. So that is one thing you can do, relaxation as well as laughter, in addition to exercise and everything else we mentioned, that will help your blood vessels help themselves. All right, and so that is a bit of a recap of the products that were mentioned, and I took a more leisurely route, so we're coming up to just 5 minutes too, but let's see in the Q&A section what we have got here. By the way, all of the products that I mentioned are, in addition to strict Canadian guidelines, tested by third-party Assura to be verified clean. They're non-GMO compliant, contaminant-free, and accurately labeled. Okay, so let's see what we've got in the Q&A. Why isn't my Q&A opening? Where's the Q&A? Okay, here we go. Here we go. Question here is, had a test that showed a high calcium score. And will K2, so K2 has been shown to reduce arterial calcifications, and I can't offer specific medical advice, certainly in this type of a forum, but K2 has been shown to reduce arterial calcifications. Usually with a high calcification, you want to sort of keep a very minimal levels of D with higher levels of K2, but that will help. Okay, what effect does sugar have on the heart? Well, sugar interrupts the blood vessel lining. I think that was a question that was asked early on, and by now, I think you probably know the answer, that high sugar levels will impair the endothelium function and the ability of the endothelium to heal itself. Question here is what my take is on heart congestion, but I'm not sure exactly what that refers to, so I'll just see if it comes back later on. Is statin use associated with developing dementia? I have seen some research that suggests that it is, but I'm not an expert in that area, but certainly I've come across some studies that suggest that it does. If someone has calcification of the arteries and they are over 60 with slightly elevated cholesterol and the LDL being too slightly high or bad. So anybody who has known calcifications of the arteries does need to take, any and all of the steps mentioned here. But if the cholesterol is slightly elevated and the LDL, this is where you want to do the test for LDL oxidation, something called lipoprotein A. You want to see if that, you want to make sure that HDL is as high, the good cholesterol, as it can be, and that the LDL is not oxidized. So that's a test that is worth having. Oh, why is the calcification test not widely available in Canada? Because we can't afford the equipment. The CT scans, because of public health care system, like these CT scans that do this type of testing are really expensive. In the States where it's covered under, everybody's private insurance, those CT scans are widely available, but they aren't in Canada for that reason, that the machines are super expensive. How much does the heart scan cost in the States? I haven't looked at the price in a few years, but it was a few $100s, like depending on where you're going. I've heard it between 200 and 500 between Florida and New York State kind of, or New York City sort of thing. So how much do coronary artery scans cost typically? Yeah, you'd have to check out Buffalo MRI or one of those types of heart scanning places, but a few $100. So yeah, question, if you haven't, so this is the thing, right? If you don't get the test, how do you know there's calcification? Well, you don't. And so if you don't know there's calcification, then you just have to sort of, some ways you could say, kind of pretend like it's there or it could be there. So everything we mentioned, the vitamin K2, the magnesium, the moderate exercise, that kinds of thing. Then those things are worth paying attention to. What causes angina? So this is it can be caused by spasming in the arteries. And it's good that you're getting that checked. That's important to get that checked out. It's good you have an angiogram coming up. I've been advised to take blood pressure medication. I want to avoid institutions. No, if you've been advised to take blood pressure medication, absolutely, please take blood pressure medication. If you want to work with a naturopathic doctor or other experienced physician or clinician on alternative therapies or lowering, you really have to work with somebody. Do not undertake that yourself. And I would highly recommend you take the prescribed medication. If you have time, yeah, I would say don't stress about blood pressure medication in terms of if you've been told you need it and it's keeping your blood pressure regulated and you feel fine on the medication. If not, you can talk to your doctor about switching to another medication. Then you go with that. Okay. How effective is CoQ10 in regulating cholesterol? Take it along with my statins, not happy about taking. Oh, why I'm watching this. Okay, so CoQ10 does not regulate cholesterol per se or at all. But the point of CoQ10 is that when you're taking a statin medication, the statin medication will prevent your body from making any CoQ10, and your CoQ10 levels tend to go down and be depleted, which can have all kinds of problems associated with it. So CoQ10 isn't to regulate your cholesterol, it's to replace or replenish cholesterol that is depleted by your statin. So that's why it's important to take with your statin. Where would someone get the requisition for the heart scan in the US? In the USA, if your family doctor might be able to do it. Certainly a cardiologist will automatically send you for one, but I hear from lots of people, actually I guess most of them are going through their cardiologist, but you can just go to often online, print out the requisition and get your doctor to sign it. Re-endothelium I'm not sure which study. I'll have to look at which study. I'm not sure which study you're talking about there, Shirley, in terms of the endothelium. Oh, comment here from Deb. One can't avoid stress. That is absolutely true. We can't avoid stress. And so we have to find ways of managing stress, whether that's through things like cognitive behavioral therapy, which is looking at our thoughts and feelings and response and mental chatter when it comes to stress, exercise, breathing, meditation. These things do make a difference with our stress response. So yes, we can't avoid stress, but we need to find better ways of dealing with it. What's considered high blood pressure? Well, I don't know anyone who has blood pressure of 120/80. So blood pressure does change from day to day, from hour to hour, minute to minute. But for the most part, you want to have your, especially the lower number, that 80, you want that to be around 80, and the high number, the 120, you want that to be, you don't want it to be getting up too much higher than 140, but it's not a single reading. It's what you're regularly getting on a regular basis. You want it to be as close to that 120/80 mark on ongoing readings as you can. And if it's regularly higher on both numbers, and especially the bottom number, then it's something that needs to be paid attention to. Question here. My understanding is the ratio of certain fats that is the risk of and not just the omega-6 itself. You're absolutely right, Caitlin. In terms of dietary intake, it is the ratio between the omega-6 and the omega-3 ultimately that determines, how healthy our diet is. But omega-6 tends to be way overrepresented in the North American diet, and omega-3 tends to be way underrepresented. So anything we can do to get the omega-6 down and the omega-3 up will be helpful. Yes, there will be a replay of the presentation available. I can try to make the slides available. I'm not sure exactly how to do that, but the presentation will be posted on YouTube in the next day or so. Is avocado seed oil better than omega-6 oils? I am giving it a tentative yes. I have to say I have avocado oil in my cupboard and I do use it. And I haven't done any deep digging as to whether there's any problematic aspects of it, but certainly something I cook with myself. So I use avocado, I use coconut oil, I use butter, lard, and also olive oil, of course. Eating sunflower seeds is fine. You're not ingesting the massive amounts of oil that you do with sunflower oil. Not a problem to ingest the seeds. Can I please elaborate on antioxidant food choices? Yes. Again, that color. Anytime you see color, so we talk about colorful fruits and vegetables. So as many different colorful foods, berries, cherries, eat the rainbow of vegetables, that all that color means antioxidant, as well as herbs and spices. All of those things contain antioxidants as well. I frequently roast vegetables in the oven with olive oil and sea salt. I do too. Is this bad or not? Yeah, so it's true that olive oil, they say, is not supposed to be, it's not the best oil for high heat cooking. That coconut oil and grapeseed oil has a higher smoke point. Avocado oil has a higher smoke point. I have to admit, I do occasionally just roast with olive oil too. Yes, so markers of cholesterol oxidation includes lipoprotein A is probably the best one that you can find. When I mention sugar, are you talking about I'm talking about added sugars. So added artificial processed refined sugars. But for the most part, natural sugars, unless you're really eating a ton of dried mango, you can definitely get too much sugar in from doing that. But for the most part, natural sugars are okay, but it's the added sugar. I don't quite understand your question here, Gerald. Is how important to take Lipitor blood thinner? Lipitor and blood thinners are different things, so I'm not quite clear. Certainly, if you've been prescribed a blood thinner, you should take it as recommended. So this is a great question from Diane. Question here is, would you say LDL at 3.8 is too high? I was told it should be under 3. It depends. Again, here we're looking at ratios. So if your LDL is at 3.8, but you are a otherwise healthy female, especially a healthy female over 60, I'm already not concerned. If your HDL is over 1 or even over 2, I'm not concerned at all, because you've got lots of good cholesterol. Your LDL is a little bit high, but make sure that you're having enough antioxidants in your diet that keeping that LDL from oxidizing. So just on its own, it's hard to say whether a 3.8 is too high. But again, especially for a healthy female and anybody who is 60 plus, I'm really not concerned at a teeny weeny little bit of higher cholesterol, as we saw in the study, not associated with higher risk of heart disease or heart attack. Not a problem. Okay. What is the difference between CoQ10 and ubiquinol? Oh, great question, Michelle. This is, so coenzyme Q10 is like many nutrients. It comes in 2 forms in the body, a form that is able to donate an electron and a form that is able to accept an electron. And it'll actually move in the body back and forth between these two. As it throws and catches electrons, it moves back and forth between these 2 forms. You can get CoQ10 in a supplemental form in both what's called ubiquinone and ubiquinol. Ubiquinol has a stabilized electron on it, so it acts as you could say it's a more effective what we call electron donor. Ubiquinone doesn't. Ubiquinone, most of the research around CoQ10 has been done in ubiquinone. It is slightly, you could say, it is definitely a little bit less expensive. Ubiquinol, it is considered to be slightly more effective form of CoQ10. It's also slightly more expensive. So either way, if budget is no matter, no concern, go ahead, get ubiquinol. But if you are on maybe a limited budget, you're watching your pennies rather when it comes to your supplements, then ubiquinone, regular CoQ10 will get you there too. I'm confused. I heard your prestigious doctor on the radio recently indicate that vitamin supplements can be quite dangerous. I don't know who this was or what they were saying, but I can tell you that Health Canada would not be keeping anything on the market that is quite dangerous. So who knows? I have no idea who that was and what they might be saying. What kind of magnesium? So I did touch on, hopefully answered already that question about magnesium. There's different forms: citrate, bisglycinate, whichever one you prefer, depending on budget as well as gastrointestinal reaction. Okay, Danielle, which is worse, canola or sunflower? I guess if I had to pick one to cook with, I'd pick with sunflower, but either, especially at high temperatures, is a real problem. What prevents cholesterol from being oxidized? Well, lots of antioxidants. Pick your favorite antioxidant: CoQ10, curcumin, any antioxidant will help your cholesterol from becoming oxidized. Oh, my husband's allergic to soy. So you can get lots of food allergies and sensitivities. Yeah, you can absolutely get soy-free vitamin K2 supplements. He can go with cheeses. I've heard of people who make their own fermented natto using the natto culture and non-soybeans, like black beans or whatever, if you want to experiment with that. Oh, great question from Patricia about fish oil. So this is really important when it comes to fish oil, and that we're choosing sources that have been purified, free of contaminants. It can be overwhelming and hard to choose. And so I had this, where is that slide? Oh, can I only go back? Here we go. So this symbol here, Isura, ISURA, and the little flower, that is a good thing to look for. You'll find that on a number of different types of fish oils and other types of natural health product supplements that are verified to make sure they are, exactly, what the label claim says, and no unwanted or, unexpected contaminants. Oh, question here is high risk for cardiovascular disease. Doctors are finding difficulty finding a second blood pressure med due to side effects. So I can't say recommend a specific blood pressure or say, I'm a fan of this one, because everybody reacts differently. And it can be trial and error for some individuals to find which medications they take and combinations of medications that will work. Certainly magnesium can safely be taken along with blood pressure medications, but that's not to be taken instead of any kind of prescription medication, but that's just a matter of finding a combination that you continue to work with your doctors. Does vitamin K1 have any role in endothelial function? Not so much. Vitamin K1 pretty much works in the liver, does have a role in making clotting factors, but not a big role in the endothelial function. Any tea in particular? Herbal, in terms of quercetin, green tea is a great choice, but black teas as well, herbal teas. Yeah. Can laughter be purchased in a soft gel format? No, but you made me laugh with that one, Michael. Thank you. Wouldn't that be great? If laughter and medicine came in pills, they would be the most prescribed medicine. If you are, sorry, for some reason I've got this new computer and apparently at this time of day it just goes dark and I need to find a way to fix that. I can barely see my screen now. If you are saying someone with a high calcium score, I'm not saying someone with a high calcium score should not take a statin. I'm saying that you can have high cholesterol, you can have high calcium and have high cholesterol or not have high cholesterol. So those things can be independent. Do we need to take all those supplements, or there are a few key ones? That really depends on, the individual, your heart health concerns, risks, lifestyle factors, even symptoms. Typically, everybody needs to meet their recommended daily intake of magnesium. So that would be a place to start, I would say, for everyone. If you don't think you're meeting that through diet, which is very challenging to do, that is a really foundational nutrient that can make a really big difference in overall well-being. So that's a great place to start. Are there natural ways to lower blood pressure? Again, magnesium is helpful, but always take your recommended medication. Why is ubiquinol more expensive than regular CoQ10? It's just the method, the manufacturing process that it goes through to give it that like stabilized form. It just costs more than a regular CoQ10. How does the oxidation happen? I'm gonna have to. There's so many questions. I don't know if we'll be able to get to them all. I'm going to have to wrap it up soon, but great question, how the oxidation happens. There's a few ways of oxidation happening. The main thing is not having enough antioxidants in the diet or having too many free radicals in our bodies. So lots of free radicals in the body, and that can happen through lack of exercise, too much stress, the cholesterol circulating for too long before it binds to its parking spots, you could say, is another thing that can happen with oxidation. A question here is best food and drinks, but I'm not sure what that refers to. Are natto beans the same as soybeans? So natto is a fermented type of soybean. So they take soybeans and they ferment them into this natto, this like sort of slimy soybean dish. Is collagen okay to have if you have blockage in one small artery? Yeah, collagen does not affect arterial blockages, but hopefully that you are getting checked out by a cardiologist. Do we need to know what calcium levels are before we take vitamin D? That's an excellent question. We don't. We know that calcium makes us absorb more vitamin D, but we don't see problems associated with taking vitamin D. How does one raise their HDL? Fantastic question. Everything I've already mentioned in terms of being proactive, exercise, reducing stress, increasing antioxidants, and omega-3 essential fatty acids are all helpful with HDL. Like, is it just me, or I can't get my screen to brighten up now? Sorry, guys, I can just barely see my screen. This is a new computer. Hold on, it's actually getting kind of ridiculous. Let me just see if I can fix this. Sorry, guys. No, I can't do it while I'm in the webinar. Okay. Oh my goodness. Okay, I might have to wrap it up here because I can't seem to brighten my screen up. Maybe there's a button. Hold on. Ooh, I think I found a button. Okay, I think I can see a little better. Okay. There's a long, okay, let me just see if. Yes, there's a comment here from AD about magnesium bisglycinate being a mix of magnesium forms. That is true. Fermented foods. So kefir and sauerkraut are fermented foods, but it just so happens that neither of them are particularly high. Actually, sorry, kefir hasn't been tested for its K2 content. Sauerkraut doesn't have a whole lot in it, but the cheeses I mentioned, Brie, Gouda, Jarlsberg, Gruyere are a few that come to mind. My doctor advised me to take blood pressure medications. Are there any red flags? Just go for it. Just go for it. Take your blood pressure medication. Vitamin K2, CoQ10, and omega-3. Yes, they can be taken at the same time. What about hair testing for calcium amounts? Hair testing for calcium won't tell you what's in your arteries. Is it true that vitamin K2 should be taken with vitamin D? Yes, I do like them. They don't have to be taken at the same moment, but I do like taking them together. My screen is just going to make beeping sounds. Oxidation test is the lipoprotein A. It's not part of a normal CBC ordered by your doctor, but you can recommend it. Question on, I don't know if you can find how, if possible, to find 100% bisglycinate as you were asking. Does alcohol consumption have any effect on arteries? Yes, the effect is complex. There isn't a simple, straightforward answer to that. There's a complex relationship between alcohol and cardiovascular health. Okay, and there are lots more questions, but unfortunately, I do have to wrap it up. I really appreciate your passion on there's dozens more questions that I don't think I'll be able to get to. I really appreciate your passion on this topic, and I'm sorry if we weren't able to get to every single question because there's lots of them here, but there will be, as I mentioned, the recording for this will be posted within the next couple of days on the Healthy Planet YouTube site. Thank you so much, everybody, for your attention and your interest in the topic. It looks like we may be wanting to revisit this one. Oh, and I see the link here from Deb to whoever was commenting about reactions to natural health products. So I'll absolutely check that out to find out what that is about, as well as take into account your questions here for incorporating more information if we revisit this topic in the future. And thanks, everyone. Take care, stay healthy, and have a good night.